and I'm trying not to fall asleep. I don't know why. I was trying not to. I was resisting, and then eventually I just don't know what happened. You know, say the doctor them and everybody see the hoo-ha and everything in the operating theater. The first thing I did was ask for my phone. I'm awake. The surgery went okay. And I again fell back asleep. Hey, welcome to another episode of the Justine Review. My name is Justine. I'm based in Jamaica and I do reviews of products, services and experiences, and I also do some vlogging and lifestyle content, and I do some travel vlogs because I travel a lot. But today's video is gonna be slightly different. I know I've been a little bit MIA for the past few months on YouTube, and that's for a reason. I had been dealing with some health issues. I'm back now. I'm better. I'm good. And from you can see from the title of this video, I'm gonna be talking about removing fibroids, which is what I had done. I actually had to do a surgery late last year. I got a bikini cut, and I'm gonna be telling you all about that experience, so if you're dealing with this issue, you can know what to expect from the process. I'm gonna be sharing what my experience is like, so you might be able to have some insight on how it works and maybe some of the things to expect. Remember that my experience may not necessarily be your experience, but I'm sure that this information would still be useful. And this is a very personal video, and I contemplated about whether or not to share this information online. But if I had somebody who had done a video like this, if somebody had done that, if I had seen one like this before doing the surgery, it might have helped to allay my concerns a little bit, because it was a scary time for me. I have never done surgery prior to this, and so I got some serious anxiety. So let's begin. All right, so this process pretty much started in June of 2023. I went into my gynecologist's office for a routine pap smear. That's it. I went in for a pap smear. And my doctor is Dr. Michael Abrams. I'm sure most Jamaicans know him. He's a very popular comedian, and he's also very well known as a physician, specifically a gynecologist. So I went to see him for that reason, to just get a pap smear. All right? So I go in. Of course, you do the usual. He does what he's supposed to be doing to check for the pap smear. But before that, he, does an exam, presses into my abdomen and all of that. As soon as he pressed into my abdomen, just so, right, just so, on the right side here, he's like, girl, you have a huge fibroid here. I knew that I had fibroids, but I didn't realize it was like anything to be so concerned about. He's like, yes, this is huge and you will need to have it removed. He immediately said to me that this is not his first recommendation for when he finds that his patients have fibroids, but in my case, because of the size of it, and I'll put a picture of what it looks like somewhere up here. Because of that, he's like, girl, you're gonna have to do surgery. From me ear surgery, so me get nervous, long time nerviness, very nerviness. Oh my God. He explained what to expect, and he told me that I would have to go and register at the Andrews Memorial Hospital, which is where I did it, but that's where he does his surgeries from. So I went in. Dr. Abrams gave me a date that would work. He said I should do it on a Thursday, and it should also be at a time when I'm not having a menstrual period. I had done the appointment maybe 2 or more weeks before, so I had all of that time that I had to think about this. And I'm gonna tell you right now, I already have anxiety issues, and that just made it go tenfold. The thought of doing surgery was so scary for me. If you've never done surgery before, and you're worried about it, it's okay to feel worried. It's okay, because it's something that you've never done before. You're going to be cutting into you, you're going to be putting you to sleep, and all of those things were very, very scary to me. I was very worried about it, and even though I prayed about it and everybody was telling me that it is going to be okay, I feel like unless you've done it and experienced it before, you're never going to think it's okay really going in. I was especially scared of the putting me to sleep part. I literally was having panic attacks every day leading up to the surgery for the full 2 weeks. Crazy. Now, I'm not telling you this to scare you, and I'm not telling you that this is going to be your experience, but I want you to be aware that it's not an easy process. You will get through it, because obviously I'm here, I got through it, and it really wasn't so much for me to worry about. But I can tell you that because I'm on the other side of the experience. You really don't know what's happening when they put you to sleep. When they give you the anesthesia, you don't know. You're gone, boop. So I would tell you how that part goes. But yeah, as I said, I was really scared. I had panic attacks. I had a lot going on as well. Work was really busy, work was really stressful, and then I had to be preparing to be off of work for pretty much almost 2 months. Yeah, so it was a challenge for me. You go in the night before, you register at the hospital, they take you to your room. At Andrews, you can choose a single room or you can choose to share a room. The single room obviously is going to be more expensive, and so I chose to share a room, which was fine because I still had my privacy. I had a view outside the window that I could look downstairs, and it was cute and cool and all of that. The bed was okay, the facilities were comfortable, it was clean, the staff was mostly friendly, and I felt comfortable there. The hospital staff briefed me, they asked me a whole set of questions, I filled in several forms in relation to the surgery, and then a nurse came into my room and she explained exactly what the process was going to be, who was going to be in the room, what the room would look like, what to expect. There would be instruments, the doctor is going to be there, the anesthetist is going to be there, other staff, nurses, etc. are going to be there, and they're equipment and everything, all of that is going to be there. My roommate was also doing the same procedure with the same doctor, so that was kind of a cool thing. We got to bond over that and talk about it and so forth. So yeah, so I didn't really have an issue with sharing the room, and we were both sharing the same doctor, having the same experience, so that was good. So the nurse also explained to us, they gave us the gown, and then they told us, listen, you will get up tomorrow morning, you will shower, you will put on no body products, no deodorant, nothing. Naked as the day you're born, nothing, no lotion, no perfume, no makeup. I mean, I don't know why I'd be wearing makeup, but nothing. The next day, early in the morning, the anesthesiologist comes and she explains to you what they're going to do when they administer the anesthesia. She explained what the possible side effects could be, and she also pretty much just told me what the process was going to be like and what to do or what not to do after the surgery, and how I can help myself in terms of not to experience some of the possible side effects that could come from the anesthesia. And she told me exactly how they were going to do it, where they were gonna stick the needle and all of that, and that I wouldn't really feel it and all of that jazz. So she did all of that, and she also asked me questions about my health history. The same thing happened with the nurse the night before. They asked me if I was on any medication. If there were medications that I had, they took it and they started administering whatever medications my doctor prescribed for me to use. And yeah, that's how that part of it went. And so my surgery was the one that was done first, and so I went down first that morning. So I went down with the anesthesiologist. Before that, the nurses tell you to leave all of the things that you need, like to clean up, shower, I brought pads, I brought towels. You have to bring your own toilet paper, guys, because they don't provide you with toilet paper. I mean, I expect that most people know this, but bring your own toilet paper, bring your own towels. If you want to bring your own sheets, you're allowed to do that. You should also bring your own food. Point of information: you are not allowed to eat after 10 p.m. at night, leading up to the surgery. I don't know what the reasoning is, but you know that when you're going to do surgery, they tell you can't eat the night before. So I think we had up until 10 p.m. the night where we could eat, and they encouraged you to eat as much as you could until that time, so because you're gonna need to sustain yourself. Really and truly, that never really bothered me, because I try not to eat late at night these days anymore, or even at nights generally, and so it wasn't a big deal. It just felt like any other day, and then by the time you wake up and whatnot, they'll eventually give you food and whatnot. So that part wasn't a problem, but just know that you're not supposed to eat past a certain time before your surgery. So after all of the explanation from the anesthesiologist, she took me down to the operating room. The operating room was downstairs. The room that I was staying in is upstairs. So went down the lift. She was talking to me. We had, a regular conversation. Then when I went downstairs, I was greeted by the other members of staff. I sat outside of the operating theater at first. They took off my bed slippers. I had some really cute bunny fuzzy beds. I know this is not relevant, but yeah, that kind of helped to make me feel good too. So I had some really cute bunny fuzzy slippers. So you carry your bed slippers, your nightie, everything, you know the drill, right? So I wasn't in my nightie. I was wearing the gown that they gave me and the bed slippers. They took off the slippers. They put a mesh hat thing, those doctor hat things that they put on your head, the same. I don't know how to describe it, but they put something on my head, suffice it to say. And they also put them on my feet, and that's how I went into the operating theater, in the gown and the thing on my head and my feet. Yeah, when I went in, the staff just had general conversation with me. I think one of the nurses there had braces, and she saw that I also had braces, and so we were having a conversation about that. The anesthesiologist told me to sit in the middle of the operating table. So say the operating table is like this. She told me to sit with my legs here and my back here, and then the machines and stuff are here, like right here. And Dr. Abrams was here at the time when they were administering the anesthesia, and the anesthesiologist was here where my head, I think, would be going, right? So they're there, they're talking to me, they're explaining to me, what to expect, etc. I'm there going out of my mind, panicking, scared out of my wits, but they tried their best to talk to me and, let me feel comfortable. And then they put the IV into this hand. Yeah, so they put the IV in the vein here, and I remember them putting in the IV, and I remember feeling the fluid coming up and whatnot in my vein, and I'm there thinking and worrying and fretting, and I'm trying not to fall asleep. I don't know why. I was trying not to. I was resisting, like, what on earth? And then, the doctor felt like I was nervous, and he squeezed my shoulder here from behind. He was squeezed my shoulder and kind of was just rubbing my back, etc. And then eventually, I just don't know what happened. I just went out, and that was it. I woke up in the bed in my room a few hours later, I'm guessing. I don't even know how many hours later, but I just woke up in the bed a few hours later, and that was the end of the surgical part of it. Back in the room now. This was a drama. Oh my god, this was hilarious. So the first person who came to visit me is my friend Tracy. You've seen her in my videos before. Let me tell you something. Tracy told me that, and other people tell me, the nurse, when I woke up out of surgery, first of all, the first thing I did was ask for my phone. I asked for my phone, and I called all my family and all of the people who were important to me, and I told them that the surgery went well, I'm awake, and I'm okay. And I promptly fell back asleep. And then I wake up again, and obviously I think that I'm just waking up, so I asked my phone again, which was already in my hand, and I called everybody and I said, hey, I'm awake. Surgery went okay. And I again fell back asleep. And I think I did that probably 3 or 4 times until I finally came around and I was okay. And my friend Tracy was there laughing at me for at least she came during her lunchtime. So I think the 2nd or 3rd time that I did it, she was there laughing at me and saying, Jess, you know you called your father already. And then when I called daddy, daddy said, yes, Jess, you told me this. I'm sure everybody was something like, this girl, I wonder, is she all right? Is she really all right? But yes, obviously I'm here, I'm okay. I guess that's one of the symptoms of the anesthesia. And like after the first time I woke up, I think I asked the nurse, because I was feeling pain. Like I really could not move my bottom half for that night. I was afraid to move because it did hurt. Me not gonna lie, you feel the little pain. You can't move. Like you can't move. You cannot move. So, and the cut is like, let me see if me can show no. Like let me see. Can you guys see? All right, so it is way down here. So unfortunately mine could not have been done laparoscopically because of the size of my fibroid, and I removed, or the doctor removed a huge one huge one, and I think 5 other smaller ones that were there. So as I was saying, I woke up, I was in pain. I asked the nurse for more pain meds, and they were giving me Baralgin and this other one, I think is Panadine or something so, but it was the strongest medication that I could get for pain, the Pana whatever that was. I'll look it up and put it somewhere on the screen. And I said, nurse, can I get something more for the pain? She's like, sis, you're gonna have to go back to sleep. Go back to sleep, because that's the only way you can escape this pain right now, because we've given you the highest amount that you can get. I can't give you any more pain medication, so me just have to hold it. I had to hold it, me have to stick it out like a G, and by sticking it up, I mean go back to sleep, because like what? I'm not a pain girly. I don't do well with pain, but I felt like I pushed through. I troopered through, and after that I woke up, my family came to visit, my dad, my brother, my friends, and so on, and I was very loopy. I was so loopy. I was saying all kinds of things that I don't remember right now, but I was so loopy. It is not funny. Well, it is very funny actually. But yeah, I was really loopy that night. Visiting hours I think were at 6. I don't remember exactly what the visiting hours were at Andrews. I'll put them on the screen somewhere here. But there's a morning visiting hour and an evening visiting hour. Yeah. And so after that night, my butt hurt me so bad because I was lying on my back, and sleeping on your back is not easy. Mind you, the medication helped to knock me out, but it really wasn't easy. I don't remember if I got anything to eat that first night, but of course, actually when I woke up, my IV was on this other hand, and the thing that they put the IV on was up here. So they were administering my medication, I'm guessing fluids and nutrients through the IV and so forth. And so that's how that part of it went. And then I think they started me off with some tea in terms of what I could, you know, when they started giving me something to eat or drink, they started me with some tea. And then we went on to progress to apple juice. I eventually could drink water, and then they gave me soup, broth. And at Andrews, it's a vegetarian hospital, and I already eat plant-based, so that was fine for me. But they do milk and eggs. I think they do dairy and eggs, but they don't do any form of meat, and I don't think they do fish either. So it's beans and vegetables and rice and all of that they provide you with, no meat. The nurses, they come in periodically. They check on you, they check your temperature, they take your blood sugar, they take your blood pressure, all of that jazz. They come in very frequently to check on you for obvious reasons. And usually in the morning they do that as well, early in the morning. And a nurse also comes to bathe you or tidy you, because you know, say you can't really bathe in the bed. Let me tell you, this was the most humbling experience of my life, because now I was awake. Like, me know say the doctor them and everybody see the hoo-ha and everything in the operating theater. However, I was awake for it now. Like, the nurse was washing and wiping down everywhere, and everywhere, including down there, had to be cleaned and washed. She had to wipe me down, everything, put on me deodorant, put on little lotion for me, whatever I needed, put on whatever clothes I had there. You had to wear a sanitary napkin for the period for quite some time. In fact, you had a little bit of a flow of all different fluids, not just bodily fluids that come up because of, you know, the surgery. So I had that for quite maybe a week or two until after the surgery. So yeah, so you of course had to carry sanitary napkins with you, and thankfully I had, and obviously a change of underwear. I couldn't even put on underwear. Them just have, because there's like a urine pad thing with them put on the bed. Well, I'm sure a lot of people are familiar with that. But yeah, she had to put it on for me. She had to put on everything. It was humbling. And I was wearing a catheter. A catheter is inserted up into your bladder, which means it goes up, yes, down there. So the nurse bathed me, and then the other nurse, when I had to have the catheter removed, came in and took it out. That wasn't uncomfortable for me in terms of pain. It wasn't painful. You felt it. There's a little ear thing, because it's like they stick it up in you and then they inflate something to keep it up inside of you so that it can't just pull out easily. So all the nurse did was she deflated the thing that needed to be deflated, so that you hear the little swooshing sound and you felt the deflation, and then you just feel her take her little time and pull it out. And that wasn't painful, but it was awkward and there was slight discomfort. The IV, it wasn't so bad either. I thought it was going to be more painful. I think I psyched myself out for a lot of these things that I was worried or scared about. So my experience was that it wasn't too bad on either side, but at the end of it, you're going to feel some little lump things in your vein eventually until it goes away. I can't show you. It's like some hard things in your hand until eventually it just go away, like your vein have it. The doctor explained what it was to me, but eventually it goes away. Because right now me even feel see it so, but right now it's not as bad as it was before. Before it was very sensitive to touch, it was very hard and you could feel it moving around like a hardening of the vein, but I don't have that anymore. Well, I do, but it's not as pronounced. I don't even know if that is the word to use, but it's not so apparent. My friends were just so supportive. So many of them came to visit me, and I'm just so grateful for that. My family was really supportive. I'm just truly blessed and grateful in that area of my life, and I have to just be thankful for that. So the next phase of the recovery process was being able to walk, being able to get up, because the day after the surgery, the nurse assisted you with easing up out of the bed, because for the whole time you're lying flat, but your goal is to be able to get up, at least ease up like so, and turn around and be able to stand. Let me tell you something, that was not easy at all. It wasn't easy. Oh my gosh. But I managed to do it a couple times on that day, and then in the evening I was able to sit up get out of the bed and move over to a chair that was on the other side of the bed. So I was able to do that, and then eventually the nurse said, you know, I had to be able to, you know, walk out of the room, go and use the bathroom. And when you go to use the bathroom, you had to pee in a container so that they could measure your urine and they could test it and whatnot. So they did all of that. All of that was a process. My nurse who helped me to walk, she was so amazing. She was really cool. She was very attentive. I really liked it. I'll put a picture of her somewhere here, of me and her, because we were doing this during breast cancer awareness, and she and I went and took pictures and all of that jazz. She was really a cool nurse. She was my favorite nurse there. But yes, I was walking back and forth and so on during the after the surgery on the second day, and that was the Friday. And then by the Saturday, I was discharged from the hospital and allowed to go home. My doctor prescribed me some pain medication that I needed to purchase at the pharmacy outside of what I was taking home from the hospital to help manage the pain. And to be honest, it wasn't so bad. I could walk, I could actually sit in the vehicle a little. Obviously I had to sit in the vehicle to go home. I have stairs at my apartment, so I could walk up the stairs and so on. But it took a little while for me to be able to move around in any comfortable way. I could move around, but barely. I could walk and stuff, but to be honest, that portion of it where it was really difficult was shorter than I expected that it would have been. Also, I have to tell you, you really will need support, whether it's some friends, family. My dad and Erica, my dad's lady friend, were here with me. My friend, my family, my Steph, my cousin's girlfriend, my cousins, everybody. I had so much support. I remember when I told my dad about it, he said he was gonna come up, and I said, Dad, how long are you gonna stay? And he said, for however long you need me to be there. And I'm really grateful. Thank you, Daddy. Thank you to my family. Thank you to my friends, because I really am touched by the support that I got from my family and my friends, but especially my dad. My daddy's girl through and through. My father miserable, you know, but I love him. I love my daddy. I'm really, people, those who know me know how I talk about my father. So yeah. So that was the process. When I came home, by the time I got home, I could eat. I was told by the anesthesiologist to drink a lot of fluids, drink coffee, drink coconut water, etc. So I was drinking a lot, and I could eat regularly by the time I got home. So whatever my family was cooking is what I was eating, except that I don't eat meat. I've started recently to eat fish, so they could give me fish, and they were really just feeding me, making sure I'm okay. I couldn't shower for a while, so I just had to, you know, wipe up and clean up and do the necessary, but that was to be expected. And shortly thereafter, you know, I was able to, you know, take a shower based on my doctor's recommendations. Being at home, I really just had to stay and rest. You really have to rest. You have to allow your body to heal and take care of itself so that you can, you know, be back to normal. Subsequent to the surgery, I had to go and see my doctor twice. He had to check the incision and remove the stitches. So the first visit I went, he looked at the incision. That was probably about a week after the surgery. Checked to make sure everything was okay. Did an exam, pressed into my abdomen, all of the wonderful things. Checked my pressure, checked my blood sugar, checked my weight, everything. And said that he was happy with how things looked, and then he gave me another appointment to come and remove the stitches 2 weeks later. By that time I could walk around better, but I still had to have some assistance to get around. And yeah, by the time I got to that, the removal of the stitches was so easy. Just drag it out. I don't know what I'm doing, and click and sitting and just drag it out. Do the regular examination, and I was on my way. I was good. And then the final visit I did He checked me, he looked at the incision. Again, it was pretty much healed on the outside, but the inside you're still gonna feel some slight discomfort, and I don't think you even fully heal to the point where I can lift weights and exercise and all them thing there. Yeah, the weightlifting, no, he says I can do like light weights and stuff, but no heavy weights. Probably heavy weights won't be until maybe 6 months to a year after the surgery. So that's something you need to be aware of. I think after about 4 weeks or 4 to 5 weeks, he said that I could exercise and sexercise were his exact words, so take from that what you will. And yeah, I did the surgery on the 26th of October, and I returned to work just after Christmas. If you're going to do this, you will definitely need to have some support, somebody to be at home with you, to help you move around, to cook for you, to make sure that you are, you know, comfortable. And my dad and my family stayed with me for about 4 to 5 weeks, and then I was left on my own to kind of recuperate and figure out my life by myself, cook for myself, all of that. And it took some time. My main struggle during this entire time was really with anxiety. There was one night where my cousin had to take me to the hospital because I was trembling, my heart was racing, I barely could speak, but that was because of anxiety, and I don't think necessarily because of the surgery. So if you're somebody who is diagnosed with anxiety, then you might want to be aware of that, because panic attacks are no joke. I literally thought I was having a heart attack or a stroke or something, so be aware of that. In terms of like the service at the hospital, that was good. The nurses were mostly friendly, especially that nurse that I mentioned before. And yeah, overall I'd say I had a good experience at the hospital. Dr. Abrams, he is excellent at what he does. However, you're gonna have some time issues with him because he is so busy. So you're going to have to call his office. Even if you're going to set an appointment with him, you have to call his office, give them your contact information, and he will call you to set up the appointment. And it will take him a few days to call you to set up the appointment. So that's what my first visit with him was like. And then when you, like, as a regular patient, and as a post-op patient, there are tiers with which you get attention. I'm not sure exactly how to explain it, but I have his cell number and I could call him if I had any issues or if I had any questions. And because he knew that I was immediately post-op, he would answer the phone. So that was my experience with him, but I will tell you that initially you will have some challenges getting through to him because he's a super busy gynecologist. He has a lot of clients. When you go there, he's always back and forth. He tries his best to, during your appointment, give you your individual attention and focus on you and your issues. But outside of that, do not expect any spoon feeding. Just know that. But I still very highly recommend him. He's really very nice. He helped to calm me. He checked on my mental health. He gave me tips. He gave me advice. And yeah, so that was my process. That was how it was for me. As I said, since then I've had maybe 3, I haven't said this yet, but I'll say since then I've had maybe 3 menstrual periods. 3? Yeah, because I had one like almost 2 weeks or a week and a half right after surgery, and I'm like, what on earth, why? That one was pretty light but still uncomfortable. The second one somewhat light, but I had a good flow, but nothing compared to what it was like prior to the surgery. And then the third one kind of picked up a little bit in terms of the heaviness of the flow, but it's definitely not anywhere close to what it was like prior to the surgery. So your period, for me, my periods got a little bit lighter. I no longer have any discomfort in my abdomen. I don't have any pain, and I just thought that this was a regular period. I didn't realize that the pain that I was experiencing during my period was not normal. I just thought that was the norm. It's not, guys. It's not. If you have fibroids, that is not the norm. It's very different after they've been removed. The flow is very different. You feel different. I don't feel any pressure, because I used to feel this pressure right here, so I never understand what it was. Now I know. Now I fully understand, and the removal has made life so much different for me so far. I don't know what it will be like further down the line, but for right now, I feel a lot better. I've even lost some weight. I'm more comfortable. I'm not worried at the end of the month. Like I used to worry that I can't go to work because I'm wearing I'm wearing a pad and a tampon, and within an hour I have to be changing it 2 hours. Every 2 hours I will just be sitting, and I just feel a huge flood. I don't know what to do. I had to always wear black every single time, and I still do that, but like there was I could not be comfortable anywhere and not be wearing black if I'm on my period. It's not like that anymore, and I'm truly grateful for that. Thank you, Dr. Abrams. You did an amazing job, and so far I haven't had no issues. The cut is there. You can see the scarring, but I can tell that very soon you won't be able to see it, and it will just be a very fine line right there. Get some antacid, because that really helps me right after surgery. And you know, because you're taking so much antibiotics for me, it grated on my stomach, so that's something to look out for. It was very uncomfortable. You had to make sure that you eat with the antibiotics and the painkillers. So just a point of information and something that you're definitely to note and take into consideration. But yes, I think that is it in terms of what my experience was like. If you have any questions about the process, anything that I didn't explain, or anything that you might want to know more about, I'm happy to answer your questions in the comments down below. So feel free to reach out, guys. I'm happy to answer. You can also share what your experience was like in the description box. Any recommendations or tips that you might have for persons who are going to be doing this procedure, you can share it down below. If you're going to be doing it, or you know someone who's going to be doing it and you have questions, feel free. I'm an open book here. I hope you found this video to be useful. I am really hoping that this helped somebody, and that it will prepare you even a little bit if you're about to be doing this procedure. So once again, thank you guys so much for watching. This really isn't my usual content. I usually do reviews. I do, travel vlogs. I do reviews of products. I do reviews of experiences. I do reviews of hotels. I share, I vlog at the hotels, etc. But I thought that this experience was something worth giving you a review of and explaining to you, so that you can be prepared, or somebody else can be prepared, or you can just have the general knowledge, because you never know when it might be useful for you. So thank you for watching. If you found this video to be useful or helpful, or you like my content, or you want to learn more about my channel, feel free to subscribe. Just click on the subscription button. If you want to know when I upload new videos, then you can hit on the notification bell. I'm also on other social media platforms. It's at JassineD on Instagram, Twitter, and TikTok. Guys, I really love you so much. So thank you for watching again. Cheers. Bye.